Good morning. This is Renee, Goodman Dental Care. I'm here with Mr. Alan Friedman this morning. We're talking about the benefits of both Invisalign and implants. We know how healthy it is to have a mouth that is free of infection and free of plaque. And as you align your teeth with Invisalign, we know that you can be plaque-free. And sometimes when you have an infection in a tooth that leads to tooth loss, you will need to have it replaced by a dental implant, and especially with a front tooth, it's very important. We're going to talk to Mr. Friedman about his experiences and the benefits that he's found along the way with both of those treatments. Go ahead, Mr. Friedman.
Thank you, Renee. Gary Goodman has been my dentist since 1989 when I first moved to Annapolis. It has been a very satisfying relationship, and I want to talk about it a little bit. First of all, Gary has always been very direct and honest with me in explaining various issues connected with my treatment and answering many questions for me. And I do ask a lot of questions. I've always had full trust and confidence in his skills and professional judgment. And I want to talk about two significant conditions that he recently treated that have had life-changing consequences for me. Many, many years ago, since I was young, the front 6 teeth in my lower jaw were very crowded together and uneven. Surprisingly, no dentist that ever treated me when I was younger, and even Gary during the earlier years of my treatment, no dentist had ever said to me that I should do something to straighten those teeth, although I did ask. They simply said that my bite was fine and my jaws were correctly aligned and nothing really needed to be done. But one day in 2011, Dr. Goodman suggested that I consider Invisalign treatment to correct that condition. Now, I didn't know anything about Invisalign except that I had seen a few ads on TV, but really didn't pay much attention to them. But Gary showed me some videos and photos of what Invisalign had done to treat other patients, and that encouraged me to go on the internet and do some exploring of my own and to get do some independent reading about Invisalign and the experiences of other patients across the country. So within a very short time, I was convinced that Invisalign was worth a try for me, even though none of the treatment was covered by my dental insurance. So in January 2012, at the young age of 68, I began a 14-month Invisalign treatment program. From the beginning, the Invisalign was the most painless and manageable way to straighten teeth than I could possibly have imagined. The aligner trays were easy to wear, easy to remove, easy to put back in, and best of all, they were relatively easy to clean. And best of all, no one even knew I was wearing them, really, except those close family members of mine. After a while, I began to even feel uncomfortable when I was not wearing the aligners. For example, if I forgot to put them back in after eating or snacking. And if I went to bed at night after brushing and flossing my teeth and I forgot to put in my aligners, sometimes I just couldn't fall asleep because I felt that something was drastically wrong. So now my Invisalign treatment is completed, and the result, as you can see, is unbelievably good, and my teeth are straight and they look terrific.
Amazing.
Now, I had a second, more serious issue than that, though. As a result of a childhood injury when I was quite young, one of my 2 prominent upper teeth, which is this one, was broken. And for more than 50 years, I had worn a series of crowns on a post, that mounted on a post in that position. And it looked reasonably good. And my current crown that I had was now many years old, and it was discolored, and it was too short because my gum had receded. And you could see the gum line and a dark metal post at the that was holding that crown in place, and it was really didn't look very good at all. For several years, though, Dr. Goodman had been saying that he could not in good conscience make me a new crown to put there because there was significant bone loss in my upper jaw as a result of a prior infection at the base of that broken tooth. And there was the metal post could no longer be trusted to hold and support a new crown. Dr. Goodman said that I needed to have surgery to remove the remaining root of the broken tooth and then to have a dental implant placed in my jaw, which would provide a solid base for the new crown. I was always reluctant to undergo such extensive work and to upset the status quo, even though my front tooth was very unattractive, and I kept brushing him off and saying, maybe later, maybe later. Well, several months into my Invisalign treatment, Dr. Goodman finally convinced me that the Invisalign presented the ideal opportunity to fix that upper tooth finally. He said that because I was already wearing Invisalign aligner trays, I could have the surgery and go through that recovery period without most people ever noticing that I was missing an entire tooth in that very prominent position. So I had the surgery in August of 2012, and by the middle of 2013, my implant was inserted after the various recovery periods that I had to go through. And in February 2014, I got my permanent new crown, which you're seeing right now. While that whole process, which took about 17 months, was going on, Dr. Goodman and I agreed, that is the surgical treatment, which took about 17 months. Dr. Goodman and I talked about it, and we agreed to slow down the remaining half of my Invisalign treatment so that I could continue wearing